Next, non-union, the fracture has not healed even after an extended period and it requires further medical interventions. So then comes to, so next we have coding of injuries. So this is the hierarchy you must remember. Okay, so the injury hierarchy looks like this. The least severe one, injury is a general term. Okay, it's a category. When I refer injury, it's a general term. Okay, you cannot define its severity. If I say injury, you must check the severity, whether it is an abrasion or contusion, laceration, okay, concussion or fracture. This you need to check further. So this hierarchy is important. So the least severe one is abrasion. Abrasion refers to a small scratch. Okay. Then contusion. The least severe one is contusion, which is bruise. Laceration, open wound. There will be cut. Okay, 1 centimeter cut, 2 centimeter cut. So when it is an open wound, we take it as laceration. Then concussion. Concussion refers to internal injury. Okay, some organ damaged because if patient met with an accident and he got concussion. So that means that injuries, the severity specifies it has damaged some internal organs. Okay, that is refers to concussion. Lastly, fracture, which is most severe. Okay, like in the fracture, as I already said, there are several type of fracture: green stick fracture, spiral fracture, compound fracture. Okay, fracture is already the bone is broken, so that we call it as fracture. So this is the hierarchy. Okay, you need to know which one is the severe one, which one is the least severe one. Based on this severity, you can able to differentiate your coding. So firstly, first coding guideline we have for coding injuries are assign the separate code for each injury unless combination code exists. So when you met with the two injuries, okay, say for example, you got abrasion in two areas. On hand also you got abrasion, and on leg also you have abrasion. So you need to code them separately. Okay, you have separate codes and you will be coding them separately. Then sequence of injuries. Code the most severe injury per the providers first. See, sequence of injuries must and should. Whenever you are sequencing ICD, you must sequence fracture first. Okay, say for example, patient is having right hand fracture, okay, and leg laceration. So which one will be your primary diagnosis?
Right hand fracture.
Right hand fracture.
Right hand fracture should be primary diagnosis, and leg laceration you can code it as secondary diagnosis. Okay, based on severity only you need to sequence. And another important coding guideline is about superficial injuries. Superficial injuries means it is a less severe ones, not coded when associated with the more severe injuries of the same site. Okay, now if I talk about on right hand, there is one fracture. On right hand there is fracture, and maybe on the same right hand somewhere in the forearm level, the provider has mentioned patient also have 2 centimeter cut. 2 centimeter cut is nothing but laceration. Okay, site is right hand. On the right hand you have fracture information also, you have laceration information also. What we can do now?
Only fracture code.
Fracture.
So only fracture should be coded, and the less severe one to that side. Since it is the same site, the less severe one will be ignored. Okay, you don't have to code for this laceration because fracture is most severe one. Compared to fracture, laceration is less severe one. So I am going to ignore. I am not going to code laceration. I will just assign code for fracture since it's the same site. Okay, if it is a different site, then you can code separately. You can code fracture code also, you can code laceration code also, but while sequencing, you must sequence fracture first, laceration second. Getting my point? So if I mention On right hand there is a fracture, and on the left hand there is 2 centimeter laceration. What you will do now? Will you ignore laceration?
No.
Right hand fracture first, then left hand laceration second.
Correct. So PDX will be coded as right fracture. Secondary diagnosis will be coded as left hand laceration. Okay. So when it is in a different site, you can code both of them. But the thing that you have to look for is sequencing. Sequence the most severe one, and the less severe one you can sequence as a secondary diagnosis. Okay. But when it comes on the same site, then you must go with a single ICD, which is most severe one. The less severe one you can ignore. Okay. So then another important guideline related to fracture, that is default coding guideline. Okay, this guideline most of the time they can question in interviews, so you can know this. Fracture not indicated as open or closed. So the doctor is mentioning patient is having fracture. Okay, but he is not specifying the subtype, like whether it is an open fracture or closed fracture. Okay, he is not giving the type of fracture information. The type you should take default as closed fracture. Okay, closed fracture will be coded as default when fracture is there in patient, but provider did not mention whether it is an open fracture or closed fracture. Okay, then default take it as closed fracture. Okay, this is one guideline. Another default, fracture is there, doctor has mentioned the type also, but he is not specifying whether it is closed displaced fracture or closed non-displaced fracture. Okay, displaced or non-displaced he is not mentioning. Then you must take it as default, code as displaced. Okay, displaced should be coded. The default should be coded as displaced. Getting my point?
Yes, ma'am.
These are all the specification that we will be seeing in the ICD code. So when doctor is saying only fracture, but is not referring it is open, how you will take code further? Only fracture category as 52 you will get. Further you need so many information. You need to check what is the type of fracture, open or closed, whether it is displaced or non-displaced. If it is displaced, what is the site? All this information is needed. But if doctor is not giving type of fracture, then go with the default closed fracture. Same way, if he is not giving you whether it is a displaced fracture or non-displaced fracture, default always code for displaced fracture. Consider the fracture is displaced, default. Okay, so these are default rules. So example you can see here, fracture plus contusion if it is at the same time. So patient suffered a fall and presented with fracture of right forearm along with the contusion of the same arm. So which one is severe? Fracture and contusion?
Fracture.
Fracture is severe. Okay, so what I will do now? Primary diagnosis, I will code fracture. Since it is on the same site, contusion is also on the same site, shall I code it as secondary or shall I ignore?
Ignore.
So we are not going to code for contusion on the same arm because fracture is more severe compared to contusion, and this happened in the same site. So you must prioritize the severe one, just code for fracture and ignore the contusion. Same way, next scenario, fracture plus contusion, but